Hi, we are back with Doctor of Physical Therapy, Joseph Shadowski, and we are here talking about ankle injuries. We're talking about how to recover from ankle injuries and really also how to prevent ankle injuries. So what's interesting, Joe, I think there's a lot of things we could be doing, to help, at home or before practice, part of a warm-up to prevent ankle injuries, or you tweaked your ankle a couple months ago, a year ago, and it's still, you're still unsure. What are some of the things we can do to kind of just feel more confident and continue to progress towards optimal performance?
Well, I think first and foremost, it always starts up with a good warm-up. Athletes can't perform at their best if they're not warmed up. They're not ready to perform. So that's most important, first of all. In terms of preventative measures, flexibility is very important. So making sure that calf mobility is very good. So these athletes should be stretching regularly to maintain calf length and range of motion at their ankle. And then in terms of exercises, it's really important to work on various different types of exercise.
Sure.
So there's strength training for kind of full body strength training, which is going to incorporate the entire injured leg or potentially the injured leg or leg that could get injured.
Sure.
So things like squats and lunges, and those are good for maintaining range of motion and full body strength.
Right.
But then isolation exercises for the ankle. So things like rubber bands, where the patient can do eversion, inversion, to strengthen the lateral stabilizers.
Yep.
And then from there, really, really important is the proprioceptive training. The balance and stability is very important, and coordination. A lot of times why these athletes are going to be injuring themselves is because they couldn't stabilize that ankle during their sport, and so they end up injured. So working with things like an RX pad to do some single leg balance exercises,
Sure.
or a Bosu ball where they can do step ups onto the Bosu ball and it challenges their balance at their ankle.
Yep.
Or hop drills are very important.
Sure.
Athletic movements. Those are things that they're going to want to come and do later once they are pain free.
Yep.
And they show good stability. So it's really important that they either have a therapist look at them or they are sure that the strength levels are 100% before doing those things. But hop drills, so plyometric drills, box jumps, landing drills, and also agility drills. Change of direction is very important for stressing those muscles and training them to be able to withstand different forces.
Sure. I think you made a lot of really important points that I think a lot of our athletes can do, even on their own, as a pre-warm-up, as part of their warm-up before their training or practice. And like you said, an Airdex pad, an unstable surface, balancing, just getting those proprioceptors to fire, getting those neuroreceptors in your muscles, in your fascia, in your connective tissues to contract when they need to contract, to stabilize. And I think that's one of the big reasons why injuries occur. Non-contact injuries, if you will, muscles aren't firing at the right time or firing enough, recruiting enough, and that's because they need to be activated, and we activate them through different types of balance training. You said the Bosu ball. You said jumping off one foot, landing on one foot, and balancing and holding that jump. Mm-hmm. Stressing the system in a very safe and effective way can play huge dividends in continued health. Also, what's interesting about ankle injuries, sometimes ankle injuries might not occur because of a weak ankle. It might be something going on at the hip.
Correct.
It might be something else in the kinetic chain, right? And that's why you talked about full body strengthening, making sure we have symmetry, balance. We're strengthening the whole kinetic chain, because we might have a weak link here in the low back or the hip somewhere, an imbalance, but it shows up at the ankle.
Right.
Where now we have this issue, but it's really up the chain. It could be vice versa as well, right?
Right.
Could have an issue at the hip we don't know much about, but it shows up at the end. So, it goes back and forth. Anything else you'd like to share in terms of your experience as a therapist, focusing on foot and ankle?
When it comes to athletes, it's just making sure to manage expectations.
Good point.
Athletes are very competitive. They want to get back to their chosen sport, and so they're going to do anything they can. And so you really have to make them prove it. when it comes to showing that they're ready to go back. And so one of the things as physical therapists that we do is we're going to test their strength in various ways. We're going to look at their balance. We use tests such as the Y balance test to determine symmetry between sides, and watching them move. And then more importantly is the psychological aspect, making sure they're psychologically ready to handle athletic movements. So some patients might be trying to get back too quickly, and others you might need to push a little more to show them that they're ready.
Yep, that's great. Great points. Well, I can't thank you enough for joining the segment with us today and sharing some, invaluable information on one, how to, prevent injury, recover, be safe, and again, the foot and ankle is so complex, in terms of the 26 bones in that area, that foot and ankle, and so many muscles and ligaments and tendons. Keeping that healthy really is the beginning. It's the foundation of performance, right? It's really at the bottom there. So hopefully that was helpful. Look forward to more information here from Atlantic Health Systems, Atlantic Sports Health, taking it to the next level.